sperm shape, okay? So the anatomy of your sperm on microscopic exam, no, will show you the head or a nucleus, which is capped by an aquasome. Your aquasome or aquasomal sac is part of the head because that part of the head, no, as soon as it penetrates through the ovum or the follicle, the mature Graafian follicle, it will help lyse the zona pellucida, okay, with the release of your acrosomal hormones or enzymes rather, your hydrolytic enzymes from the acrosome. So mabulig ito hiya pag lyse siton imo zona pellucida. So the sperm has to pass two support of the egg. It is the zona pellucida and the corona radiata. Okay, before it can reach the ovum, which is inside the follicle, the Graafian follicle, or rather the follicle itself. Okay, so you have to note. Next slide. Next slide. Okay, this is the anatomy now. You have a head with an acrosomal sac. There's a neck and a middle piece and the tail, which has an end piece, okay? Now, the medical technologists will know that in the examination of your sperm analysis or seminal analysis, they have also to take note of the shape of the sperm. Huh? So, katamtaman na yung laki ng ulo. It will not report a big head or a small head. There is an exact size of that head. The same with the body and the tail. The tail has to be elongated. It should not be bifid. It should be double. Should not be double. Isa lang. Okay? And the movement of the sperm must be forward motion. Hindi pwedeng round and round and round. Huh? It has to go forward. Otherwise, it will not reach the egg. Okay? Next slide, please. The production of the sperm occurs within 64 to 70 days. So, para sa inyo, mga males, liwan ng sperm. Okay? Every 2 months, halos, bago ng bago. Okay? While in the females, it's different because you were born with the exact number of egg cells or follicles in you. 7 million at 5 months, 2 million at birth, and when you reach puberty, you have 400,000 eggs and follicles. So, ladies, yan na, ito yung age, let's say 22, 24, na ibanan na ang 400,000. But for the males, they have millions. They are millionaires. So, medical student ka pala, you are already millionaire. Okay? Because you have millions of sperm in you. Okay? And yan ang main difference ng oogenesis and spermatogenesis. Okay? Now, on your slide now, you have the comparison of spermatogenesis and oogenesis. Okay? So, the spermatogonium as well as the oogonium will be diploid in number. See? 2n in number. Your primary spermatocyte also has 2n in number. But the secondary spermatocyte and the secondary oocyte, because of meiosis, it will cut into half. So, haploid na siya. Okay? And during the release of the polar body, that means that one ovum will contain the chromosomes and the other ovum will have none. So, it is a polar body. Okay? Sa females. And the meiosis will only be completed once there is fertilization. For the males naman, di ba, we have the so-called spermiogenesis. So the spherical shaped spermatids, which contain half the number of chromosomes, which is haploid, will be converted to a elongated sperm or spermatozoa. So one cycle in the males, spermatogenesis until spermiogenesis, reproduce 4 of the sperm with 2 X-carrying and 2 Y-carrying sperm. Okay? So hindi lang talaga 4 lang. Maraming spermatogonium yan. So it produces millions and millions of your spermatozoa. But half of it will be Y-carrying and half will be X-carrying. So now, if you will ask me, anong chance na magkakamay-adahin male baby or female baby? It will be 50-50 because 50% of the sperm will carry X chromosome and the other 50% will carry Y chromosome. It is now the champion sperm. Kung hino ang champion, X bahiya or Y, that will be able to fertilize the ovum. Okay? So only one, kahit 1 million pa yan or 100 million that will be deposited, only one is the champion sperm. Why? Because the acrosome of that sperm will carry the hydrolytic enzymes, and once it penetrates through the follicle or the egg, it will render that egg, that follicle, impenetrable to other sperm. Magic! Pag nakapasok siya, parang magic, hindi na makakapasok yung iba. Because of the enzymes, they will have the so-called pellucidal reaction. The zona pellucida will now be impenetrable to other sperms. Okay? So you will ask me, Doktora, pwede bang makapagpanganak ang 68-year-old na husband and a 20-year-old wife? May I hear you answer, Jude Brian Abueva? Pwede ba sila manganak? 68-year-old and a 20-year-old wife. Nandiyan ba si Chang? Jude Abueva? Anybody? Baldono? Joshua?
Yes, Doc, it is possible.
Yes? Who is this?
It is possible po.
Yeah, it is possible. Because as I've said, the man can have spermatogenesis every 64 to 70 days. And the female, 20 years old pa lang siya, so marami pa siyang eggs. But if you'll ask me, a 30-year-old male against a 48 years old female, Cherise Amida, pwede pa ba magbuntis? 32-year-old male and a 48-year-old female?
I think, Doc, it's possible, pero the probability is mababa na since old na yung female.
Correct. There's a very minimal chance of having a baby at that age because, as you can see, the maximum number of eggs that you have had of the female, no, will dwindle. It will dwindle in the number of eggs as soon as she reaches the age of 35. So, talagang bihira na lang talaga ang magkaanak. Swerte lang talaga pag magkaanak siya ng 40 years old or 42 years old. Okay? So, what is fertilization? Fertilization is when two sex cells fuse to form a new cell containing genetic materials derived from both of the parents. Okay? So, syempre, di ba, half the number, a haploid sperm will penetrate through a haploid egg. So, what will happen there? There will be restoration of the diploid number of chromosomes. Okay? Hindi pwedeng diploid fertilize ng diploid. Baka ano yun, magiging giant yun or what magiging iba yung itsura niya, okay? It restores the diploid number of chromosomes. And as I've said, it will determine the sex of the organism. Mr. Capon, why will it will determine the sex of the organism? Mr. Capon.
Hello, Doc. Pardon po.
Yes. Yes. Good afternoon. Why do you think it will determine the sex of the baby or the organism after fertilization? Di ba I said merong sperm na X carrying at saka may sperm na Y carrying. So from that, you can deduce that. Mr. Capon, are you there? Oh. So you can deduce that kung ano yung champion na sperm. If it is X carrying, then it will be a baby girl. But if it is Y carrying, then it will be rather Y carrying baby boy kung X carrying baby girl. Okay? So depende lang yung kung ano ang makapass through or makapenetrate through the egg, whether it's Y carrying or X carrying. Okay? Okay. Another effect of fertilization, aside from restoring the diploid number of chromosome, the determination of the sex of the new organism is the initiation of the so-called cleavage. Okay? There'll be now doubling of your number of cells. Di ba? The ovum plus the sperm is just one whole thing. It is a one cell, but it will now initiate cleavage. That means it will double every time, okay? So it will initiate cleavage, and the so-called fertilization will occur on what part of the tube or the fallopian tube? Arpon, Maria Mitzi, what part of the tube will fertilization occur? Next slide. It is at the ampulla part, diba? There are 4 parts of the fallopian tube. You have the fimbriated end, which catches the fertilized ovum, and the fertilized ovum will travel from the fimbria to the ampulla. No, it is not the fertilized ovum, rather the ovum, the ovulated ovum. The ovulated ovum will be caught by the fimbria, and it will travel into the ampulla. Sa ampulla, doon yung rendezvous ng sperm sa egg. Okay? Sa ampulla. Okay? Na fertilized sa ampulla, it will travel through the isthmus, through the interstitial portion, and then to the uterus. And then sa uterus, doon yung implantation. Okay? Okay, in this slide, you will have, we'll move back a little, no? Sperm streaming penetrates the corona radiata and the zona pellucida, okay? Diba, I said there are 2 areas that the sperm has to pass through, the corona radiata and the zona pellucida, okay? And the acrosomal sac will have to release the hydrolytic enzymes so that there will be prevention of polyspermy. That means it will prevent the sperms, the other sperms from entering through. Okay, it will render the zona pellucida impenetrable to other sperm cells. Next slide. This one, the Aquasome reaction, will show you the binding of the sperm to the zona pellucida. We'll have the acrosomal reaction. That means the acrosome will release the hydrolytic enzymes, and the sperm will now be able to penetrate through the zona pellucida. And after that, there'll be pellucidal reaction, and it will be impenetrable to other cells. Okay, and you will now have the fusion of the egg nucleus and the sperm nucleus, and you will now have fertilization. Next slide. Next slide, we'll just show you the fusion of the egg cell and the sperm cells. Next slide. The next slide will show you that, di ba nandyan yung ovary? That drawing there in the middle is the ovary. And during ovulation, it will expel the ovum. It will be caught by the fimbriated egg, bagang kamay. No? Parang kamay siya. So it will catch the egg. And the egg will go down the fallopian tube, what part again? The ampulla, which is the widest portion. So at the ampulla, fertilization will occur. Okay? And during the 5 days travel by that fertilized ovum down to the uterus, you will have now cleavage. Okay? Cleavage on day 1 will be 2 cell stage. Next, it will be 4 days, 4 cell stage rather. Then it will be 8 cell, and so on, doubling every day. Okay. And after which you will have a morula, a berry of cells. Okay. Morula will have 1, 2, 3, 4, 5, 6, 7, 8 cells. It will continue. That fertilized ovum or the embryo now will continue on doubling and doubling until it reaches the blastocystic stage. When it reaches the blastocystic stage, it is now inside the uterus. And on day 6, it will implant at the blastocystic stage. Okay? So you have 5 to 6 days to the uterus after fertilization. Now, my question. We're just associating it. Okay? Miss Judy Cain. Miss Judy Cain, supposing that fertilized ovum will not reach the uterus in 6 days. On the 6th day, nasa ampulla pa lang siya. What happens? Supposing merong infection yung babae, meron siyang mga adhesions in the tubes, or there are certain abnormalities, merong sac, merong obstruction at the tube. So what happens to that egg? Fertilized ovum on the 6th day, still in the ampulla of the fallopian tube. Who can guess? Miss Makamay. Correct. Because, di ba, I said, after 6 days, whatever state that ovum will be, it will implant. Actually, blastocystic na siya on the 6 days. Pero hindi siya nakapunta sa uterus. Nandun lang siya sa tube. So it will implant there. So magiging Vilma Santos siya. Vilma Santos has, baka hindi pa kayo naipanganak, no? Vilma Santos is a very, very, what's this? Sikat, no? Na actress, now a governor of Batangas. Pero nag-ectopic siya dati. Ha? So yan nangyari sa mga ganyan. Na, ectopic pregnancy kasi the fertilized ovum was not able to reach the uterus. Nandun lang siya sa fallopian tube. Or minsan naman, nahulog. The fertilized ovum fell on the ovary or in the abdomen. What happens? Andrea Corpin. Na-fertilize nga siya, pero hindi naman siya nag-travel down the fallopian tube to the uterus. That ovum, fertilized ovum, fell on the ovaries, or it fell down to the peritoneal cavity. What happens? Miss Dakoy, sige. Okay. Ano? What is your answer?
Ectopic pregnancy din po ba?
Yes, it will be an ectopic pregnancy. Kasi maraming klase ang ectopic pregnancy, ha? Yung pag nag-implant siya sa fallopian tube, na ano siya, nag-rupture siya sa fallopian tube. It is a ruptured tubal pregnancy. Pag nag-implant naman siya sa ovarian tissue in the ovary, it is called an ovarian pregnancy. And it implants in the peritoneal cavity, it is an abdominal pregnancy. I've seen many of this during my practice and during my residency training. So it is very important for you to sometimes not to really see all these things so that you will be able to remember kung ano talaga ectopic pregnancy. And it really will imprint in your minds kasi most patients will die because of misdiagnosis. The bleeding will not be outside. It will not come from the vaginal cavity. The bleeding will be intra-abdominal. Okay? We can mistake this. Minsan, nagpapasahan yung mga surgeon at saka yung obstetricians because they couldn't diagnose it before the operation. So sabihin na, ano yan? Ectopic yan. Ay, hindi. Acute appendicitis yan. So it really mimics an acute, the fallopian tube, rather the ruptured ectopic pregnancy can mimic an appendicitis because it will produce what we call as an acute abdomen. Okay, so kailangan alam mo talaga kung ano ang diagnosis. There are certain armamentariums by which we can diagnose ectopic pregnancy. When there is massive bleeding inside the abdomen, what do you think will be a good armamentarium to diagnose this? Make a wild guess. Zoe Kapungkol, make a wild guess. Paano natin ma-diagnose yung ectopic against a appendicitis? Let's say, nagsisinakit ang tiyan. And then we cannot really decipher or guess what is the diagnosis. Masakit yung tiyan niya. Acute abdomen. We can use other, hindi lang physical exam. Part of this will be your pelvic ultrasound or transvaginal ultrasound because the ultrasonologist will be able to note for bleeding or bleeding in the abdomen. Okay, they can diagnose fluids inside the abdomen. Ordinarily, we do not see fluids inside the abdomen. Once there is fluid, then it could be blood or anything past cells. And so, bubuksan natin yung pasyente. It is an acute abdomen and it will have to have an emergency surgery. Okay? Can you relate now what happens during ectopic pregnancy? Are you awake?
Yes, no.
Is it
No.
clear or what?
Yes.
Any question?
Yes, Doc.
Yes, anong question?
Clear, Doc.
Ha? No question?
Doc, with regards to the ultrasound, the transvaginal,
Wait, I cannot. Can you, yung iba, mute. Oh, sige, question.
si Obehas po, Doc. With regards to the transvaginal ultrasound,
Ultrasound?
is it,
Yeah.
can you distinguish what kind of fluid will be the accumulation or not?
Yes, they can determine. That the ultrasoundologists, because of their very, very keen eyes, and they have trained so many years for that, they can diagnose if it is blood or if it is pus or if it is just fluid. Kasi perong consistency yan sa ultrasound.
Okay. Thank you.
Yeah, but before when I was still in a resident, no, hindi pa gaano ginagamit yung ultrasound. What we did was cold dose synthesis. It is done transvaginally, and then we use a large bore needle, let's say 50 cc yung syringe with a large bore needle, gauge 16 to 18. Pinapasok namin doon sa cul-de-sac, no? Just below the cervix, and we aspirate. Once we aspirate for non-clotting blood, then that's ectopic pregnancy. But if we aspirate for pus cells, yung parang nanaba, then it must be appendicitis or any ruptured viscous. Okay? Noon yun, but now we have an ultrasound. We just don't do a cold do synthesis. Okay? Did you understand? So, ano na kayo ngayon? You are now in the modern era. We don't do the cold do synthesis. We just do the ultrasound. So, the ultrasoundologist will know kung ano talaga yung diagnosis, whether it's ectopic, and they can see the rupture of the fallopian tube by ultrasound. Huh? Okay, next slide, please. Okay, di ba I've said after fertilization, you will have doubling of the number of cells. So shortly after fertilization, the zygote begins to undergo a series of divisions. They increase the number of cells in the pre-embryo, but the pre-embryo remains the same size. So the cells are rather becoming, kasi nagtitika na mo man ang cells, the embryo is the same, but the number of cells, syempre, titika gunti because they double in size, smaller and smaller. Next slide. In the 8-cell stage, it is not tightly bound, but after the third cleavage division, the cells become tightly compacted into a ball called morula. Okay? So you will have morula, and then it will not travel through the fallopian tube down to the uterus. And during the number of hours, di ba? You have 4-cell stage, you have 8 cells, 16 until 96 hours, it becomes 32 cells. Next slide. Now, in this next slide, the morula, it is next. It is now in the 32 cell stage, the berry appearance. So it's not at 8 cell, but 32 cell stage. And after that, it becomes a compacted cell, okay? Compaction of blastomeres when the loosely adherent cells becomes tightly bound, okay? Next slide. Now it will become a blastocyst again before it implants, okay? So in the blastocystic stage, you will note that it's really the blastocyst. It is a perfect blastocyst. Huh? What you have there is a perfect blastocyst. And if you become an embryologist, you will see this under the microscope. And this is the best time to harvest the egg cells pag magkakaroon ng in vitro fertilization. Okay? During the in vitro fertilization, dapat i-harvest ito Okay? Kasi the fertilization is done in vitro, outside of the mother. Okay? It is done in a petri dish. And once the fertilized ovum now is monitored, okay? Until such time na maging blastocyst siya. Pag nag-blastocyst na siya, it will be harvested from the petri dish, and this is the one that is implanted sa mother, sa female who wants to be buntis, who wants to become pregnant. So ang blastocyst, kasi this is the time that it will have to implant sa uterus. So ito yung inalalagay sa uterus by the doctor, okay, the specialist. So the embryo will now be implanted in the uterus, and hopefully the blastocyst will mag-implant siya. Okay, next slide. Okay, the blastocyst stage will have two poles. You will have the inner cell mass, which becomes the embryo, and the outer cell mass becomes the trophoblast. The trophoblasts are the cells of the placenta, okay? So once may ada na yung embryo, it will also have a placenta. They go hand in hand, the embryo and the trophoblast. Next slide. In the so-called hatching, you will have enzymatic production by the trophoblast and the digestion of the zona pellucida. Next slide. Okay, so this slide will show you that there is now beginning of placentation, placenta. Diba? I have said na they go hand in hand. The blastomeres, or the embryonal pole, the embryo, and the trophoblast, or the outer cell mass. Okay, so the inner cell mass becomes the embryo, and the outer cell mass becomes the placenta. Okay. So, diba, fertilization is usually day 14, or let's say day 16. And on day 6, it will implant. So, mga day 22 na yan. 16 plus 6, 22. So, at this stage, the blastocyst will adhere to the endometrium of the embryo pole, and the trophoblast proliferation will now produce the human chorionic gonadotropin to maintain the corpus luteum. And there will be now development of the trophoblast. And these trophoblasts, the syncytial trophoblast and the cytotrophoblast, are both cells of the placenta. Okay, so there are two types of cells in the placenta. You have the syncytial trophoblast and the cytotrophoblast, and they differ in their characteristic. The syncytial trophoblasts are on the outside. They lack the nucleus, and they just, we can just see it as a group of cells without the nucleus. But the cytotrophoblasts are the inner cells, okay, inner cells, and they are distinct cells from each other. They have the nucleus, okay? Ang cytotrophoblast will just be a group of cells, okay? Next slide. So you'll have now the formation of your syncytial trophoblast. You have your blastocyst that was implanted, and you have the cytotrophoblasts, which are distinct cells. Rather, yung syncytial trophoblasts are dark cells, no? it's not really, wala siyang nucleus. Parang nakikita mo, puro lang nucleus, rather. Okay? So it's just a group of cells, very dark. You cannot distinguish one cell from the other, unlike the cytotrophoblasts, which are very distinct cells. And these two will now form your placenta. Okay? Next slide. This last slide that I'm going to present today will show you of the formation of your lacunae. Lacunae, which are blood-filled entities in your placenta. Okay? So while you have the syncytiotrophoblasts and you have your cytotrophoblasts, you will now have formation of the so-called lacunae form, or which are filled with blood. Okay? So this is now the formation of the early placenta. Okay? Of course, you have there your embryo, your inner embryo, and your embryo pole, or the inner cell mass, which becomes the embryo, and the outer cell mass, which becomes the trophoblast. Okay, since this is day 7 to 8, meron ka ng placenta, ba? And the placenta, your trophoblasts will produce your human chorionic gonadotropin. Just by the analysis of this. Will you have missed period, girls? Meron na ba missed period? Bisan, diri pa mag 1 month? Let's say, Miss Daa, Kyla. Miss Daa. Let's say, nag-mens ka ng, yung girl nag-mens ng 16 last month. And then, this month, mga day, sa, ano pa lang, pizza 14 or 12. Can you test now the pregnancy test? Or you wait for the first missed menstrual period? Knowing that you
After
have
the presence of the,
Yes.
meron na po bang HCG? Ano na po
Yes.
ba?
Correct ka. But usually, in the practice of most wives or females, they have the test pag nag-miss siya ng period, di ba? But actually, you can already test it before the missed period. Kasi on day 8, meron ka na talagang placenta. Okay? And it will now produce the HCG, or human chorionic gonadotropin, which is your test for pregnancy. Yung mga test, di ba? Yung positive or double line, because it is the presence of human chorionic gonadotropin in the urine. So kaya siya nagpa-positive sa mga pregnant patients. So I'm just saying that, let's say, na-fertilize siya on day 14 plus 8 days, ilang days pa lang yun? Day 22 pa lang, di ba? So on the 3rd week pa lang, there could be a positive pregnancy test. But you see, you cannot really determine kung kailan siya nag-ovulate or kailan na-fertilize. So near the 28th day, doon na lang magte-test, or the first missed period. Okay? Okay, next slide, which is the slide for next time. What is the next slide will be the extra embryonic tissues. Di ba? We said, merong embryo and then mayroon about extra embryonic tissues. Back anay, yan, extra embryonic tissues, okay? Okay, next, the extra embryonic tissues. The extra embryonic tissues will compose of the amnion. Next slide. The amnion, the chorion, the allantois, okay, and These are the extra embryonic tissues, and we will have a separate discussion on this. Next slide. So the implantation is the blastocyst enters the lumen of the uterus and it will implant. Okay? And of course, you have now formation of the placenta with the lacunae and which is filled with blood. Okay, I think we will have to stop there. I will take some questions from you. This is now the formation of the placenta. Huh? So next time we will discuss about the placenta and the extra embryonic membranes, including the umbilical cord. Okay, because these are extra embryonic membranes. Yes, do you have any question? Meron ba kayo hindi naintindihan?